Thank you, Jared, our most wonderful IT guy. Wonderful. So, hi everybody. I'm Ciara VanderPloeg. I'm a mental health therapist, and I work here at Grace Health in the Student Health Center at Lakeview High School. And this is my wonderful colleague and friend Janeille DeVore. She's a physician assistant working at Grace Health main site one day, and Student Health Centers the rest of the week. So, today we were going to come on and talk to you guys a little bit about adolescent mental health. We're trying to give you guys perspectives on physical descriptions of how mental health might present, as well as how I see mental health as the behavioral health therapist. So for starters, we kind of wanted to touch on depression. Statistics-wise, we've definitely seen depression going up. So the state of Michigan is currently, for 2022 standards, they're at 125,000 youth experiencing depression symptoms, which would qualify them for a diagnosis. So Janeille, tell me a little bit about how you see depression when they walk in through the door in like a medical sense.
So at the student health centers, kids come in all day long, right? They have different complaints. When they start coming back more often with complaints of headache, fatigue, they're tired, they're not sleeping well, so they're tired every morning, their stomach hurts, so a lot of GERD. They may have symptoms of diarrhea or constipation. Headache is a big one for the kiddos coming in and I have a headache, I just don't feel good. That we call them somatic symptoms, is the presentation of a physical response to emotional problem.
And I think that's a misconception a lot of people have, is that our mental health really does affect our physical health. They go hand in hand. And so if our physical health isn't doing well, our mental health isn't doing well. And if our mental health isn't doing well, vice versa, right?
Correct.
So sometimes it shows up that way. And then I guess like on my side in terms of depression, I'm seeing a lot of kids who just want to stay in their rooms all day. They don't want to come out. They don't want to go to school. They're starting to skip on plans with their friends. They're not doing things that I would expect normal teenagers to do.
Like maybe take a shower or come out to eat dinner.
Yeah, take a shower, come out to eat dinner, like want to spend time with friends, doing something they enjoy, doing their hobbies. And
that's
so
a big one when they stop doing the things they like.
Yes. So your kid can be, the outgoing kid that likes to go out, or they could be the kid that likes to sit in and draw. But if they stop doing these things that they really love, that's typically something that I look for, right?
Don't want to play their sport anymore.
Yeah, and we get a lot of that for sure. And so, Janeille, when a kid comes in and you're starting to suspect it's a depression thing, what happens?
Yeah, so first thing I need to make sure is what are we dealing with, right? Is it a depression thing or is it a physical thing? So, asking good questions, talking with people in their life, like their parents, right? People who I can speak with. What's going on? What are you seeing? And then ruling out any major medical problems that may occur. Making sure that there's not an underlying anemia or thyroid problem or any other true physical problem that can be causing these symptoms. And we also have great screening tools to help us get to the core of it. Are you having symptoms of depression? How often are you having them? Screening tools that we use on a regular basis.
And I find that those screening tools can really be good jumping off points, because sometimes our adolescents, they are willing to put it on there, but they're not really willing to talk about it. So that can always be a good way that we talk to them and kind of get expansive knowledge on what's going on, So how do you typically treat depression?
So it's different for every single person, right? It's not a boilerplate plan where you say you do this and you do this and you do this and you're going to be all better, right? It's a process. I like to talk to the kids about what they're feeling at the time, helping them understand what's going on physically. A lot of depression symptoms are due to the lack of appropriate chemicals in your brain, right? You're not getting that release and use of the proper chemicals, so your view of the world is tainted by that. You're not able to see and respond to maybe what is really
happening.
Right. Somebody else has a completely different view than you. Like, why are you so upset? But you're really upset. You really are.
I kind of explain it to the kids like we it tends to make our worldview much more negative, right? And so somebody might, you know, do something and we kind of internalize that. We have this like negative talk, and it's really hard to stop that.
Oh, it's a cycle. It is in pop, like by yourself. I don't know how anybody ever does it by themselves.
Me either.
Yeah.
And I always try to explain to them, and you can tell me if I'm wrong, Janelle, but I always try to say, like, if this is your normal, our medication, if we choose to go that route, is only going to bring us to like everybody else's like baseline, right? So we definitely still need those tools beyond that medication to help us to cope through what's going on in life, right?
So there's studies that show completely medication and therapy work best together. I am of the belief that, especially in our youth, medication alone is not going to make things better. You need to have the medication, right, to bring that level up, to get your brain to the point where it's functioning in a little more normal, a little more efficient manner, so that when you do go to therapy, you're in a place where you can actually use those tools, those new skills that you're learning. Without medication, the therapy might not work, but for sure, therapy is like the backbone of what needs to happen for improvement in mental health. And I don't think my job would be possible in a school setting without the close relationship that I have with our behavioral health specialists. They're the
I totally agree. But I think that you guys are the superstars, of course. But kind of like moving some more anxiety, I know that like statistically 1 in 3 of our youth nowadays are experiencing anxiety. Very concerning. So how does it show up for you when they walk through the door?
A lot of times these kids are coming in feeling like they're going to throw up. So bad nausea, their stomach hurts, headaches again, racing heart. Like, oh, I feel like I'm having a heart attack. My heart's pounding out of my chest. I can't breathe. I'm short of breath. And they have a almost panicked kind of feel, look to them. Their body has initiated a fight or flight response for whatever reason. They either need to run away or fight something, but there's nothing physically in front of them. There's nothing there for them to run away from, right? So if you ran away, you'd feel better, but you can't run away. So their body again is sending out a whole batch of lies that they have to work through, and without the proper skills on what to do with that, they'll just live in that heightened sense, which is really bad for your health overall, right? It can lead to substance abuse because you're trying to curb that response. So we always, in that moment, try to bring it back, right? So we're going to help you right this second. We got to bring it back, and Ciara's taught me some really good skills on what to do.
Yeah, so we deal with a lot of anxiety. A lot of kids come in and they do feel a racing heart, and they're getting an anxiety attack. And so some of the things that I typically go to see if they help first is the 5-4-3-2-1 technique. And so you can adjust this depending where you are and what you have available to you. But I always do 5 things that you can see around the room, 4 things that you can touch around the room, 3 things that you could smell or touch or taste, and then kind of go through all of our senses depending. And if that doesn't work to bring them kind of like back into the moment, back into the here and now, I'll change it up and I'll do the rainbow. And I'll be like, find me something that's red in the room, find me something that's orange, because that helps our brain to come into the now and recognize, oh, there's nothing that's going to hurt me, and come to the forward brain, and think, okay, now what am I doing? I need to get reset. And at that time, we typically would do some box breathing. And so you just kind of take your finger and you breathe in, breathe out, breathe in, breathe out. And that can be a really helpful tool for a lot of kids because the tactile movement of moving it on a surface or on their leg can be really helpful for them to kind of become more calm and steady. And I'm just thinking from earlier, some anxiety, some kids that were coming in, you can also use like an ice pack and put it on your chest, and that would help too.
We do, even on the arms, help cool you down, stop some of the shaking. It really does reset stop that chemical release to help bring that heart rate down, kids will be shaking, panicky.
Yeah.
We just need to get them back into this moment so that we can discuss, right? Because we're not going to be able to discuss what's going on. And I find that can be something that can be used at home once you understand what you're seeing, the behavior in your child. They're panicking and you're trying to get some information on what's going on, but you're not going to get an accurate response if they're stuck in that spot. So having those tools in your own, okay, let's take a second, let's breathe for a minute. I'm not going to ask any questions. We're going to calm down some.
Yeah.
I think those are great tools to have in your toolbox.
For sure. And I think, like, if you're a parent and you have children and you're like, well, how would this appear in my child? We'll often see, especially in young boys, young men, that they might be very irritable. They might have a lot of anger. There's also going to be, some worry that's noticeable. They can't shut the worry off. They might talk a lot about things that they need to get done. A lot of kids are stressed because of COVID. We're coming back. They're trying to play catch up intellectually and all of these things. And so they're worried about performance.
Right.
They're worried about getting good grades. So as a parent, like, kind of having these conversations and these check-ins can always be super helpful, and being like, hey, I noticed that you've been really irritable lately. Like, are you worried about anything? Has anything been going on for you? Those things can be super helpful in terms of just connecting with your kid.
I noticed I've noticed too, a lot of kids, back to the young boys, spend a lot of time after they're supposed to be sleeping on their video games. They're up playing with their friends. So it's not just my kid that's up playing late, there's a whole group of them. Nobody knows it. Then they're done and they can't sleep because they were excited about their game, but then they start, I didn't go to sleep, and they're having that anxiety cycle that then they get to school and they didn't do what they were supposed to. So we know why, right, some of the things, but they can't understand that those behaviors might be contributing because they have, all this other stuff going on. So the process of going to therapy helps develop a lot of that more awareness of self and what we need to do as a human to get through our things.
Yeah. So Janelle, say, my kid comes into the student health center and they're talking to you and they do want to do or consider some medication. How do you go about that visit? So
I always try to reach out to the parents. I'll never prescribe a medication without a parent's permission. That is just basic healthcare, right? You have to know what's going on. So to prescribe a medication, we have to make sure that the rest of the body is healthy. We do the appropriate lab tests or whatever that child needs. And then, learning what are there other people in the family that have had this kind of issue? What medications have worked for them? What are the parents comfortable with? Is the child going to be able to do this every day, right? So if you're not going to take your medications regularly, every single day, there's really not a reason to start them, because you can almost make it worse, right? The side effects will get really bad if you're not regularly taking your meds.
Yeah. And what are the common side effects? So I know from my licensing exam, like anticholinergic effects. I remember that, the drying out. But what are some other symptoms of these medications?
Things that are most concerning to the kids, so like if you're prescribing SSRI, you can have side effects that range from insomnia, loss of appetite, but then other people may experience they're more tired, like they take their medicine and makes them want to go to sleep, or they're hungry all the time. So it's really individualized. You can get, headaches or restlessness. Medications can always be adjusted and changed, and just because this one type of medication gave you that side effect doesn't mean another one will, right? If it causes you to be tired, we might change the time of day that you take the medication, right? To try to manage those symptoms better. And then we always engage the family, right? Whoever the parent, the child, parent, guardian, whoever the child's living with. to make sure that we're not seeing any serious side effects, right?
Yeah.
So all antidepressants do come with the concern for worsening depression,
Mm-hmm.
and we want to make sure we catch those symptoms really early. They're very rare, those side effects, but we want to, be on our
And on the mental
alert.
health side of it, I think like when we combine that medication with depression, the good thing about that is, or medication with depression, medication with therapy, the good thing about that is that you have a professional that's also monitoring.
Correct.
Weekly typically.
Mm-hmm.
And so those sessions can be really valuable for checking in on those symptoms. I always do with my patients. And then being able to have that direct communication with the medical provider, right? But also, I think that it helps to encourage the patient because those medications take time.
They do. Nothing about mental health therapies is overnight or in a month. They say most medications take a good 3 months to notice the full effect, and I like to give it a little longer, especially with kids because I tend to go a little slower on upping the medications, so it might take a little longer to get the full effect. And then sometimes we have to change. There are so many different medications and so many different people, right? So our genetics determine what medications might work best for us, and we also have a test called GeneSight. It's just a simple cheek swab. We send it off to the lab. They do a full analysis on it. It takes a few weeks. We get it back, and it tells us, I think, more what medications might not work for you, and then they give you also a list of ones that might be a little better. Gives us a little direction on where to start, but I could start you off on a fluoxetine and find out 6 weeks later that, you know what, that medication's not great with your DNA. You don't process that one as well as somebody else, so maybe we should try something different. We switch, and all of a sudden,
it's good.
We're happy.
That's such an awesome service for all of our patients that come in. So, Janeille, if I wanted to get my kid involved, if I wanted to get them seen by you, how do I go about doing that?
So, just have to give us a call, right?
Yeah.
So we have medical sites at, obviously, Grace Health main site, so you can call that number and they can direct you to whichever school location works best for you. So we are at 2 high schools that have full medical services. So that is Battle Creek Central and Lakeview High School. And we're at 2 middle schools right now, Springfield Middle School and Northwestern. All 4 of those sites also have wonderful behavioral health specialists at them.
Yes, they do.
We have so you can call any of those numbers. You can find those numbers on the Grace Health website. Call them directly, or like I said, you can call main site and they can direct you to the correct location. And
we also have a couple of behavioral health only sites. We just started a new location at Upper Creek High School. I'm hearing good things.
Yes, I've had patients of my own that have seen our wonderful behavioral health specialist Anne out at Harbor Creek, and they just love her out there. So it's going really well.
Anne is a really good egg. We also have a site at WK Preparatory High School as well as Verona Elementary School.
Shout out to Sarah as well, because I have a couple younger kids that see her too, and they really enjoy their time.
Yeah, so we have a good range of therapists, a good range of expertise, a good range of different people that you could see. And I think that everybody that I work with is really wonderful. So
we do have a great team.
We really do.
The thing that I like at our behavioral health or our school-based is you don't have to go to that school to be seen at that school, right? Yeah. So if you go to Marshall High School, you can be seen at any of our school-based health centers. The only requirement is you are between the age of 5 and 21.
Yes, exactly. And you have a consent form signed. So if you're a parent and you're looking to take advantage of this service, you would just have to sign the consent form, give the relevant information on the back of it, and that would allow your student to come in and be seen independent of you. But of course, you always get a phone call, as Janeille has explained.
We don't do anything without your permission.
Yeah.
Outside of the protected services that can be obtained by certain age children.
Mm-hmm.
And if you have any questions about that, we're happy to answer those too.
And we're also doing a lot of sports physicals right now. So every year sports physicals expire April 15th.
Yes, April 15th.
Okay,
Mhm.
I always want to say 16th.
They're any day after April 15th, you can come to get your sports physical done for the 2023-24 school year. So right now,
Mm-hmm.
I know a lot of the fall sports are starting their summer camps,
Mm-hmm.
and they're requiring those sports physicals to be completed before.
Mm-hmm.
And we have decided to continue the $5 sports physical through the summer for
Mm-hmm.
everyone. No caveat to that. So just give us a call. We'll get you in. Please don't wait till the last minute. You can get your spring sports physical done now, so you don't have to wait till spring to get it done.
Mm-hmm. And the appointments are super fast. Janelle
Mhm.
and the rest of our team, they get them in really quick and get them out. So typically no more than 15-20 minutes.
Right. As long as we're
Doing well. Yeah.
we're just cruising on through and nothing happens, we'll get you. Yeah.
Mm-hmm.
And as long as we have a school-based health center consent signed, a parent does not have to bring the child.
Mhm.
Anybody can bring them. So we'll make sure that you get
What you need.
for that.
For sure. So, Janelle, we also were going to discuss, I'm sorry, my mind has been slipped my mind. But we were talking about our age ranges, we talked about where we're located, we talked about how to contact us. Is there anything that we missed?
I can't remember.
Okay.
I think that was it.
Yeah. So I hope that you guys have enjoyed this. We are open for questions if anyone has any questions. Just a really quick reminder, we do want to respect your privacy. Please don't share any personal information in the chat. And this isn't intended to replace coming to a behavioral health therapist or to a medical doctor, but if you have any questions, feel free to ask because we're here for you and we want to serve.
I was going to say, I remembered.
Yeah.
So we offer immunizations too.
That's what I forgot.
Yes. So if your child is, at the health centers, we do immunizations for kids 8 and over. There's some special storage for the kindergarten vaccines, so we can't do the younger kids. But 8 and over, if you need to get updated on your vaccines for school so that they can go to school in the fall, we can take care of those too.
Mm-hmm. And none of the vaccines are given without parental knowledge or permission. There's actually a separate area on our consent for that because we wanted to make sure that parents were able to separate consent for services from consent for immunization.
Yes, so those are, and even if you do sign that one, we would never ever give your child any of our vaccines without personally speaking to you.
Mm-hmm.
Not something we just go around giving.
But definitely call us and get in because I know a lot of students, they need these vaccines to attend school. I don't remember which ages need them.
Middle schoolers are one of the ones that there's a round of them, so they need to get those done.
To be able to attend. So don't forget to do that and get it done while you're here. So that way in the fall you and your student have a seamless transition back into the school year. Thank you guys for all of your wonderful comments. Does anyone have any questions? So what do you think?
Oh, go ahead. I was going to say you were so thorough.
We were. What was your favorite part about working in the student health center?
I love those students. I especially love the students with the little behaviors that might be a little frustrating to some of the teachers and their parents, but they're my people. I love those kids.
Mm-hmm. Yeah. I would agree. I think that teenagers are the most fun group because they're actually changing, they're finding who they are, they're changing like behavioral patterns and generational patterns, and I just really love being a part of that process.
And watching them grow and having any little bit of help with, like if I can give any joy to their day, it just makes me happy. We have a question.
We do. So the centers are located at Battle Creek Central High School, as well as Northwestern Middle School, Springfield Middle School, Verona Elementary School, and WK Preparatory High School, and that is all of our schools in Battle Creek Public School District. We are located at Lakeview High School, currently, and then we're also at Harvard Creek High School. Medical services are only at Northwestern, Springfield, Battle Creek Central, WK, technically, because they could go across the street, as well as Lakeview High School.
So for the summer, we have been dislocated from our middle schools due to construction, so we're so excited about the construction. But we are going to be at WK for the summer. We'll be at WK, Battle Creek Central, and Lakeview High School is where we're going to operate out of, just for the summer. And then would be remiss if I did not mention our wonderful providers at those places. Kelsey Huggett, Kelsey Harris, and Paige Turpin are our other medical providers.
Yeah, they're wonderful. We have a really great team for sure. We got another question about IVA testing for ADHD at the schools. That is something that I'm happy to offer at this time. So my schedule is opened up. So if your child has been on a waiting list to get tested for ADHD here at Grace Health, or you think your child might be struggling with ADHD symptoms, definitely come in and talk to your doctor so you can get a referral for that. I'm currently doing those appointments at least one day a week right now. We're working on the scheduling, and we're hopefully getting some more of our team trained so that we can help all of you to partner with your schools to get them what they need to be successful for the school year. So, yeah. Another question was best tips for helping somebody who's having an anxiety or panic attack. So my first step is always to get them into the room. So bring them down from what they're going through and bring them to the here and the now. Because typically when we're struggling with depression, we might be focusing a little too much on the past, where the anxiety is fear of the future, fear of what could happen. So we want to be right in the middle on the here and now. And so I always do the 5, 4, 3, 2, 1 technique where I go through the senses. I try to get them to tell me different areas in the room that they're seeing. So 5 things that you can see, 4 things that you could touch, 3 things that you could hear, and I try to get them to actually do it. So if I say, 4 things that you can touch that mouse, touch your cup. And then I also do box breathing a lot with patients. So breathing in, breathing out, breathing in, breathing out. We mentioned doing ice packs under the armpits or on the chest. That can be super helpful. There's also a lot of apps that are really good for mental health.
There's some breathing apps.
There's breathing apps. The Calm app is really good. That typically requires a subscription. If you have a younger child, there's an app called Finch, and they have, it's a little cute bird that you grow your mental health and you grow your bird, and they have a lot of good breathing exercises on there. So those are some things that you could use even out in the community or at home to help your student come down from an anxiety attack, or even you if you're struggling.
I do know that every classroom in our school has a calming corner. So there's a corner set aside with tactile things. It's kind of blocked off. It's away from the rest of the student. It's a spot that they can go to practice some of those techniques so that they don't have to leave the classroom, but still can have a space where there's not as much of that input from the environment.
Definitely.
Help calm them down.
And you can always come up with some calming corners in your own home. I think we get caught up sometimes on like what do we have to put in them, the cost of that, but think simple, because sometimes tactile stuff, it can be just the gumminess of this mouse or the feel of that paper, and those kinds of things can really help us to come down and bring
even just pillows
here.
you already have with some different
anything
on them.
So Janelle, are you finding that parents want a pill to fix it, or are you finding that they're also encouraging counseling?
It's a mixed bag, right? There's both schools. Some people just say, give my kid a pill and make them better, right? Not probably gonna work all by itself, right? Therapy plays such a huge role. But as my career has progressed, I see a lot more openness to therapy now, where people are realizing, you know what? We had to struggle through that when we were younger, and now we have tools to maybe not have to do that. Let's bring that in, and therapy is becoming much more valuable and seen. It's real. People are really putting that value to it, understanding that it has a an amazing role.
Yeah, and as the behavioral health provider, like, I know it can be so hard to trust your kids with me.
What are they going to tell you?
What are they going to say? How is she going to hear it? But I am just there to be your partner in this small human, right? And so that's kind of how I look at it. I want to make sure that if parents want to be engaged in the process, that they're able to be. And I'm always trying to give parents updates, like, this is what we're working on, this is the treatment plan, this is what your kid's supposed to be doing when they're feeling anxious, but this is how you can help them, this is how you can direct them. And so I think that with that openness to counseling is also coming that openness to being part of the process, and that's been really cool to see even just in my career.
For sure.
Really great questions. Thank you guys. Are there any more that anyone has? I will say, while we're waiting for potentially more questions to come through, I am excited. Today is the last day of school. I will miss everybody in about a week.
Oh, I know.
But right now I feel good. And I've loved seeing everybody's prom pictures and all of the students' like last end of the year activities. Those have been so fun.
So fun. Here they come back and tell me about their field trips, and so some of them went to the zoo and I got to hear about their favorite parts, and some of them went to a baseball game. Oh my goodness, those kids love that baseball game.
Don't tell everybody at Grace Health, but we have like the best jobs here.
Yeah, they're going to want to take it away.
I know, because we get to do fun things and learn about fun things. Do you do group therapy at the schools or family therapy? Yeah, we have our provider, Anne, who is working at Northwestern in Harbor Creek. She really loves group therapy. It's become a little niche of hers. And so she is definitely doing that. I know myself and my fellow provider at Lakeview, Kendall, we were hoping to do a psychoeducation group on healthy relationships. So we're trying to get that off the ground for next school year, because we're finding a lot of our high school students are struggling with like identifying what's healthy and what's not. And so I know a lot of us are doing different types of therapy at the schools. And so definitely, if you're wondering if we offer something, give us a call. And if it's not an area of expertise that we have, it's definitely something we'll know to put on our list for the future, so we can get educated, so we can provide the best care possible.
I love that our job is fluid, right?
Yeah.
We can meet the need of the students that are in our building right at that moment, instead of using data from years ago to try to meet. We physically see what's going on and what conflicts there are, what struggles there are, and we can make a plan and start meeting that need right away.
And I mean, if I would have had me in high school, I think I would have done really well.
High school would have been a completely different experience.
Or even just the health center, like being able to go in and talk to a doctor when I needed it, that would have been extremely valuable.
Right. And I know there's so many people out there that missing a day at work would just be devastating to them. So, but your kid is sick, or your kid has a need, what are you going to do? And being able to just communicate with the parent while meeting the need, here's my kid, and I'm on the phone with the parent at the same time. I do that all the time, where they're in the room virtually, but the kiddo's in front of me, and we can take care of a lot of issues that way.
Especially if your kid, like I was one of those kids that struggled with migraines. I still struggle with migraines. It's a part of my life. But the amount of times a parent had to leave home just to come pick me up so I could go home and take medicine, it would have been very awesome for my parent to have had you to give me meds and send me back to class and
even with
see if I did better.
We can prescribe you meds, and then we have a fabulous pharmacy that can deliver them to your home.
Exactly.
So I think it's a 25-mile radius for delivery, or we can have them delivered right to the school.
Yeah, and the students are able to come at the end of the day and take them with them. You guys would know, of course, that they had them, and that would help us to definitely get you guys medicated properly, as well as help us to treat you better.
So so the question is, do you refer kids to other services at Grace Health? I do all the time. I refer to our dietitian for kids for nutritional concerns. We've seen a huge uptick in type 2 diabetes and other metabolic disorders in the adolescent population. So I'll refer to our dietitian, and I also refer to physical therapy. lots of kids need physical therapy, so I utilize that service. We use the pharmacy all the time. Yeah, there's some people that have students in the schools, but the kids don't want anybody at school to know, right, that they're going to therapy. So I do have some students that will see therapists at main site instead, and always refer to our dental. We try to use that dental as much as possible because I have a special, encouragement for good oral health that's near and dear to me.
Our next question is, how do you stay connected with kids during the summer months? So we are open every day. Most of our centers are currently open 7:30 to 3:30. Some of our providers prefer working 8 to 4. So if you're doing mental health at Springfield, it's 8 to 4, right? So we are here all summer. Some of the things that we're doing to stay connected is definitely like pushing the sports physicals, connecting with coaches at our schools to get the whole soccer team in one day, the whole football team in one day. It makes for a fun time for us, and it helps us to check in on our kids and see them. We're also doing virtual appointments if there's a need and your child can't come see us physically, say they're at home and you're at work. We are able to offer that service too. It's just a matter of a phone call, and that's for both behavioral health and mental health, or mental health and medical health.
There is a back to school event in August for Battle Creek Public School students where there's a healthy living fair. Carnival. That's a great event. It's fun to be had by all. We do sports physicals there. We have mental health screenings. I think the health center or the health department is doing vision and hearing.
Yeah, they do that.
We might, and there's vaccine clinics in the summer that we might be working towards, but we reach out to our kids all the time. We know who needs services, and we'll reach out to the parents and find some way that we can get them to an appointment or provide that service for them for the summer.
Yeah, we also have wonderful resource specialists here at Main Site Grace Health, and they've helped us to coordinate rides if a student needed like a Medicaid ride to come in for an appointment because their parent couldn't bring them that day. So we find a way. I think that's one amazing thing about our team is that because we're so used to being so fluid in our work, we get very creative and inventive when we need to.
A lot of thinking outside the box.
Another question was, what is the age group that we service? So we can see kids from 5 to 21. And so if you have even a college student who needs one of those sports physicals, definitely send them our way. And does my child have to go to the school in order to receive those services? No, we will see anybody from the state of Michigan. So if you are located over in Detroit and you just find yourself over here and have time for a sports physical, we would love to see you. We also see students who are homeschooled, so you don't have to attend a public school to come in to receive services from us. It's anybody in the community age 5 to 21. We're happy to be here for you.
And the services that we provide are any service that you could get for your child at Grace Health, right? We're not just there for ice packs. We're not a nurse's office. We are a fully functioning medical office. So, childs, if your child is sick, you can call us. If they need their sports physical, they have an injury, we can do whatever they need.
Asthma rechecks, a lot of
Lots
things.
of those. Yeah.
So we definitely would love to see all of you guys and all of your students and your kids. The summer months have been kind of like medium. I wouldn't say slow, I wouldn't say busy, but we really love when we are able to see our kids and see what they're doing and talking to them and what adventures they're going on. So please bring them to us because it helps us to stay busy.
Although we do have a lot of work to do.
Yes, we do have a lot of work to do, that's for sure. That's for sure. If there's any other questions, we are able to answer them.
I do want to thank everyone for joining us.
Yes, definitely. It's been much less anxiety provoking than I thought it was going to be, so that's good.
It had to be less than I thought it was.
But I am so thankful you guys all joined with us. I'm so thankful that you guys trust us with your students and that we have the ability to serve in the way that we do. and we're just happy to be here.
You good?
Yeah. So we will go ahead and wrap it up. If there's any questions that happen in the comments after the video is stopped, I'm sure our lovely staff will help us to answer those questions for you afterwards. But thank you so much for coming. We appreciate you being here, and we hope you have a good rest of your day. Bye.